Today, ministers of health from Africa have taken a significant step in the fight against malaria by signing an important declaration and committing to accelerate efforts to reduce malaria deaths. Malaria is one of the greatest health challenges our region faces. 11 of the 12 countries with the highest malaria burden globally are in Africa. The declaration signed today is not only pivotal for its objectives to reduce malaria mortality, but it also comes at a crucial time when progress against malaria is stalling. We urgently need to reignite our efforts and to put the region back on track to end this deadly disease.
We, the ministers of health representing the nations of Africa with the highest malaria burden, gather here today with an unwavering commitment to the fundamental principle that no one should die from malaria, given the tools and the systems available.
Nous sommes engagés, nous allons nous mettre au travail et nous demanderons simplement à ce que les experts de par le monde nous accompagnent. Le Cameroun sera toujours jouer sa partition dans cette vue, dans cette vision d'une Afrique unie, solidaire et beaucoup plus forte, n'est-ce pas, pour pouvoir remporter les défis à venir.
La signature de la déclaration de Yaoundé revêt une importance capitale dans la lutte globale contre le paludisme, dans ce sens que c'est la manifestation au plus haut niveau de l'engagement politique de ces autorités pour davantage de ressources domestiques investies dans le cadre de la lutte contre le paludisme, avec des interventions et des couvertures optimales pour les outils de prévention, mais aussi les outils de prise en charge, le renforcement de la surveillance épidémiologique du paludisme, mais aussi le renforcement des systèmes de santé, y compris les soins de santé primaires, dans le cadre de la lutte contre le paludisme.
This is an incredible milestone moment. We have ministers of health, we have donors, we have civil society to bring everyone together in this pivotal moment where we're facing headwinds and challenges like never before in malaria, bringing everyone together to really realign our priorities and understand how do we move forward and how do we recommit all of us together to say we have to chart a new future.
To be able to get all these ministers together in one place and for them to sign a declaration, I think is a step really further on in the fight against malaria. And hopefully they go back home and implement, what's in the declaration. And then it also brings them working together.
It is an important milestone because, as you know, we've reached the perfect storm when it comes to malaria. There's the issue of biological threats in terms of resistance. There's the issue of climate change, issues of conflicts on our continent, and issues of funding. I think this is a great opportunity to bring the ministers of the high burden, high impact countries together to recommit themselves, recommit the countries into really prioritizing malaria.
We're at a really interesting time right now. Now and in the next 5 years, we're going to get more tools from the R&D pipeline that have potential for high impact. And we really need preparation for rollout of those, including data-driven decision-making around an increasingly complex resource allocation. And that means increased collaboration across malaria partners that includes strong local leadership, partnerships with countries, and then finding new ways of working together so we can better leverage work across health sectors.
Together, we can change this story for families and communities across our continent. It will take political leadership, country ownership, and the commitment of a broad coalition of partners. Thank you all for your commitment to realizing our shared dream of a malaria-free Africa.